Dr. Chen Xi, Assistant Professor of Public Health at the Yale School of Public Health. Tell us about this 8-year plan to try and help with survival rates.
Thanks for having me, Mike. So China issued a Healthy China 2030 and with the action plan and guidelines. And later on, China also issued the Cancer Prevention and Control Action Plan, which attempted to make continuous efforts in comprehensive risk factor control, cancer screening, early diagnosis and treatment, and the standardization of diagnostic and therapeutic protocols. So those are the key strategies to effectively mitigate increasing cancer burden in China.
It's interesting listening to that report, and I thought it was a really interesting feature that psychological treatment also added, because the mental part of fighting cancer is a big part of this, and you don't hear a lot of talk about that. I wanted to get your thoughts on that.
Oh, there has been some conventional treatment like the robotic surgery or the physician-performed surgery, chemotherapies and radiation therapies, but more and more innovative treatment methods coming out, like psychiatric therapies you were mentioning. And also in the last about 15 years, China is also trying to innovate new cancer drugs as well. Those are defined at the molecular entity level, was also approved. But more recently, there's some encouraging news that innovative cancer medications becoming available and being approved by the US FDA, which is an innovation. And we will see more and more innovative therapeutics and drugs coming out.
Yeah, so more cutting-edge treatments coming down the road. One of the things, though, I think it's important, maybe we can talk a little bit about this. We know that awareness campaigns can be very effective, because if you can identify cases early, it goes a long way in increasing survival rates. Can you talk about efforts perhaps to get people in high-risk categories to just maybe go see the doctor more often, get more regular checkups?
Yeah, indeed. China, like many other countries in different stage of development, cancer remains a major public health concerns. The cancer profiles in China reflect both the developed country and the developing country region. So, for example, as you were mentioning, the screening rate is much lower in rural compared to urban. So the early screening is really mattering a lot, because of the size of the tumor when it has been identified matters to the survival rate. But in China and like many other countries, insurance coverage, access to healthcare and affordability plays a big role. The lower income individuals and those with less access to the pharmacies and healthcare facilities are usually suffering more from late diagnosed or even never diagnosed. So, and also there's a selection by the residential area, like by pollution, and also economic disadvantage. So people living in a less disadvantaged area may have more risk factors that also worsen their incidence of cancer. For example, they have more like prevalence of tobacco use, alcohol use, and they suffer more from obesity. And all this play a big role. And as you were mentioning, globally, the cancer disease burden is increasing. This is also due to the accelerated population aging on a global scale. And we know that population aging is a major trend, and which also drives up the cancer incidence.
Yeah, there's a lot to digest there. Thank you so much for your insights. Always a pleasure talking to you. Appreciate it.
My pleasure.